Hello and welcome to episode 2 of my anatomy classes here on YouTube. So if you haven't already, please subscribe because there'll be lots more of this so you can learn about all the stuff that goes on under the skin in your face that ages you, makes you look older, and also that makes you look younger, and things to do, tips and tricks, but basically the anatomy and physiology and the medical side of what's going on to cause these things. So today, episode 1, I spoke about how to prevent the frown lines, or what actually causes the frown lines, so how we can treat them. And today I'm going to talk about smile lines. So when I smile, I have very few smile lines. I am 50 next year, so I should have more than I do, but I regularly have my anti-wrinkle injections. I use Botox. I have it every 4 months, so it does last. I only have mine 3 times a year, and I'm quite happy with that because I like to be able to move my face. I like to be able to be expressive, and I like it to look natural. So in my clinic you won't see duck lips, you won't see frozen faces and surprised brows. Everybody looks very natural. I advise people, keep looking like you. Do not try and look like somebody else. Let's just turn back the clock a little bit and still be you. So today we'll move on to smile lines. So here is Sally the skull, who's been living with me in my clinic for many moons, and she's now got a bit of a makeover. I've done these myself out of good old plasticine, so those that are my age would probably used to play with this stuff for hours. Taking the, gruesome as it sounds, layer of skin off, we see these fat pads underneath. And underneath the fat pads themselves, so you've got a layer of skin, a layer of fat, and then underneath there you've got your muscles. So around the eye area we have a circular muscle, and it is called the orbicularis oculi. So let me just take these bits of fat off. I will probably do some more videos with the fat just to show how that ages us as well. So underneath this bit of fat, which is the under eye, the tear trough area, this muscle is called the orbicularis oculi. So it is a circular motion, a circular muscle all the way around the eye. So it joins in the middle here, near just above our tear duct. But it is actually a circle, and the fibres are joined together in a circle. So they are connected to our nasalis muscles and the procerus, which we spoke about yesterday, that can cause the frowning issues. So it is the orbicularis oculi that squeezes together, allows us to blink, and allows us to smile, and sometimes allows us to sort of squint, and if we've got a funny smell up our nose, like it pinches a little bit here at the side of the nose. So this can be treated with another area of Botox. So this is the second most popular area of anti-wrinkle treatment. So how we treat it is just very superficially. So it's a tiny needle anyway, and it doesn't go in very deep at all. I do 3 injections each side of the eye. So obviously both eyes. Some people do ask. It's both eyes classed as one area. So you get both sides done, but that is one area. And so the exposed part here that I'm showing you is the bit that crinkles up as we smile, and again we need to base the injection points on individual anatomy. So mine, it's quite smooth up here. I do get a line that comes a little bit further down here when it completely wears off, so I would be doing 1, 2, 3 injections here. and I like to do an injection close to the brow, especially if we have done a brow treatment as well, because that helps to raise the eyebrows and really opens the eye and makes you look and feel more awake. So in the case of Sally, obviously she's got no skin, so we can't see where the wrinkles would form. So it would be 1, 2, 3 injections. The licensed dose is 4 units per injection. Now, some people, if they've got stronger muscles, if they've got longer lines, or if they're a little bit older, may need a higher dose, which is called off license. So for example, I've got a lady who is in her 60s and she comes regularly every 3 months because she doesn't like it to wear off totally. And for every new customer, I do the licensed dose. I do a free 2-week follow-up appointment to check to do a checkup, and if people need more, I do the extra top up and then calculate how much will be needed for the following appointment. So in 3 months' time, rather than having to have 2 appointments to get the dosage right, I'll know exactly what they will need, and then that's done, and then they don't need to have a second appointment. They can just come back when they're due 3 months later. So this is the orbicularis oculi. And thank you for watching. Please subscribe, because I will be doing lots of these videos, and like I say, we're talking about Sally's anatomy and showing how the various parts of the face and neck eventually get aged, and what treatments we can do about it. So thank you for watching. Please subscribe, and I'll see you again soon.